after you've gone to sleep with the lecturers, you would now come back to say that you didn't fail, to be an oversight, that you will mark it and then send it to nursing. It's really painful for me that because of whatever reason that you have, you costed up a whole year to help us. We both cried. 1 year is a lot. It's already recorded 27F for someone whose script was not marked. Where did the score came from? So the first time I ever determined that whatever it takes, I must get to the peak of nursing career.
Dr. Yetunde, congratulations once again for joining of erudite scholars and nursing professionals across the world globally. A doctorate degree to your name comes with great sacrifice, hard work, commitment, and strong personal responsibility. Can you share with us, how did you achieve all of this?
Okay, thank you very much for that question. I'd like to say that it's impossible for me to achieve this without the help of God. That's the first. And all that I am, all that I have, and all that I would ever be is in Him, the author and the finisher of my faith. And He's been my refuge and my fortress. So all glory to Him. And I would not say that this is only, I don't have any input in this. So I would say that it's a lot of effort, hard work, and then it's also a lot of sacrifice, like you mentioned earlier. And I also rode on the shoulders of giants. I have a family of support, my parents, my siblings, my husband especially, and my friends and my classmates here. So it's not only my effort, it's God's strength. It's the effort of a whole community to like bring me forth to this level. Yeah. So this is how I'm able to achieve it. Yeah.
You decided to become a nurse professor during your undergraduate years. You know, can you tell us what actually influenced that decision?
There are actually a lot of things that influenced that decision. And the major thing is how I was treated as an undergraduate student actually influenced it. I both had the sweet and the bitter story of being an undergraduate student. And maybe I'll just talk about the sweet experience, which was I had a very good supervisor as my undergrad project supervisor. And first, it was the one that brought out my research strength and my writing skills in terms of research, and he identified it early. And while I was doing my research for RN licensing exam, I worked on factors influencing exclusive breastfeeding among childbearing age women. And then during my midwifery exam preparation, you know, you have to submit another research. I actually wanted to like use the same research from my RN. And then he insisted that no, go and do another research. While he accepted for others, he insisted on me doing another research. And I sat down and I asked him why. He said that because I know that you can do research, and this is something I want you to like build your capacity on. The more you write, the better you become, and things like that. And he was very, very helpful. And also I saw that beyond the bedside as well, there is more to nursing. Like there is shortage of professors in nursing in Nigeria, if you understand, because they are trying, all the professors in nursing, they are doing their best, but they are overwhelmed with the student-teacher ratio and things like that. So why join the pool of workforce on the bedside? Why not go into teaching younger generation about nursing, about how to become a better nurse? Yeah. So this is my strong motivation to become a nursing professor. Also, the pay is also there, so I won't lie about that. The pay is a little bit better. It's a little bit better than on the bedside, and then I think you have more flexibility to your work as well. And as a family person, you have more flexibility, and yeah, you have a wider area to explore. Like aside from teaching, you can get involved in research, non-governmental organization, access to different places. So this is one of the reasons. These are my reasons for looking into becoming an academician. As an undergraduate, I crossed into nursing, right? I did pre-degree.
Oh, you did start with nursing.
Oh, I did. I got admission into Ladoke Akintola University of Technology through the pre-degree program, and I was given SLT, even though I wanted nursing. But later in 200 level, I crossed back to nursing. So the basics in LAUTECH, that's Ladoke Akintola University of Technology, Ogbomoso, every first year student take the same course. So it's easy for you to switch program because we all have the same foundational course. We moved to our various departments in year 2. So I moved to nursing. However, I wasn't sure about the fact that I will get into nursing because I don't have the connection. Even though I have the grades, I don't have the connection. And I really did not go for lectures that much in 200 level. However, with the help of God and with the help of people, I got into nursing. Myself and my roommates, we transferred to nursing. And I think the list came out a week to the exams. And we just, with the help of a couple of friends around us, we're able to get the materials, the notes, and then stuff like that. And then we read and we wrote the first semester exams. And then out of 12 courses, we passed 9. And there's this rule in nursing as at then. I'm not sure if this is applicable to other schools, but in my school, there is this nursing rule that if you fail 3 courses, you have to repeat the class. So I actually repeated. However, my roommate also had this was one of my bitter experiences that I would like to share. Right. So my roommate also had 3 fails. And then I was having a missing paper in my biochemistry. So I went to that was awaiting result, AR, we call it AR. So I was having AR in my biochemistry, and then I went to the biochemistry department to check for it. And then normally any department that we are, once you list the student's matric number, my roommate's matric number comes first and then mine comes next. So on checking the list, we found out that our name was not on the what's it called, the master list, the marking sheet of biochemistry. And she had already been recorded as failed. That made it the 3rd course that she failed in nursing. So we were like, so we told the man that she's also looking for her biochemistry. The man asked for a matric number. The man checked and said, your name is not on this list. So he went into the storeroom, brought out the scripts, and then saw that they did not mark our own scripts. So the man said, oh, that this is, he's very sorry. This must be an oversight, that he will mark it and then send it to to nursing. And then when he sent it to nursing, he gave us the note and everything. And then when we got back to nursing, you know, the response we got was, oh, that after you've gone to sleep with the lecturers, you would now come back to say that you didn't fail this. And it was already recorded 27F for someone whose script was not marked. Where did the score came from? So it was really painful for me that because of whatever reason that you have, you costed her a whole year. Because if she had she could have, if they had like accepted the score, she would have had just 2 fails, rewritten the exams, and she wouldn't have to repeat. Yeah, she wouldn't have to repeat alongside me, right? So I was like, this was so unfair. We both cried. We didn't know anyone to help us. We both cried. 1 year is a lot in terms of any man's journey. 1 year was a lot. So this was really, really painful. And I would say that that was the first time I ever determined that whatever it takes, I must get to the peak of nursing career, whatever it takes. I am here already, and I'm going to be a change agent in terms of education for nurses. Yeah. So that's one bitter experience that stuck with me as an undergraduate student back then. Yeah.
With over 31,000 or more universities across the world, you chose the Chinese University of Hong Kong. I'm interested to know why particularly. Is it Chinese University of Hong Kong that chose you, or you chose them?
I think we both chose each other.
Oh, interesting.
Because if I didn't apply, they won't come to my house to choose me. So I chose them and they chose me in the end. So we both really chose each other. Yeah.
But why that university? Why the Chinese University of Hong Kong?
So the question I always ask is why not? Why not? So you have a university that is one of the top, within the top 50 universities in the world, and then they have in terms of nursing, like in terms of course, nursing ranked 16th in the world in this school. It ranked first in Asia and first in Hong Kong. Where else would I want to be? Where else would I want to be tutored? It's not as if other nursing schools are bad, or other nursing schools that rank below them are not good enough. But you know that in terms of the way we value quality education and being competitive, being able to stand shoulder to shoulder with other people around the world is highly essential. And I also got a scholarship, so why not? Your nursing education is fully funded and you say you're not going. Like the Yoruba will say that like they ask you to come for free food and you're saying, oh, the date is far. Did they ask you to bring oil or bring salt? So it's like that. Anyway, what I'm just trying to say is that they have the resources, they have the how do I put this now? I'm looking for that English word. They have the qualities. Chinese U has the manpower and the intellect that will help me, because right now I am the one looking for help. They have everything that I need to help me grow. So why not? Yeah, I chose them, and they also saw my potential. They chose me. So
in one of your Twitter posts, you specifically acknowledge INR Nigeria, which is the Institute of Nursing Research, and also FCNSW, which is Fellowship of Christian Nursing Southwest Zone, for their support, particularly how they are able to, provide that support that, you were able to lean on during your journey to becoming a doctor. How crucial are these two organizations in your journey?
The Fellowship of Christian Nurses is the parent organization to INR. That's the Institute of Nursing Research. And I'm grateful that they birthed the Institute of Nursing Research. And when I was still a raw material, INR found me, and then they saw the potential in me. And you know, when you're given a leadership position in INR, or where someone sees the raw potential in you, even though you're not looking like the finished product yet, and then the person sees the strengths that you have and puts you in a position where you have to like break your own personal limits and then come out of your shell. They just want me to get better every day. Like when they give me a session or training, we have what we call the journal clubs in INR, and they give training sessions to different leaders, and they made me the director of research and statistics, which means I have to be on my toes with respect to what I know, because every other person working on research should come to me as a research person. And what do I know? So they gave me the platform to like see that I need to be better at this, I need to do this. And they also gave me support, moral support. They were encouraging me all the while. Sometimes I make mistakes. They tell me, they correct me in love. It was really a great journey. And for the CEO of INR as well, I have a personal relationship with him, and he's also studying here, and which makes my journey very like, you know, when you look back, when you look behind you, you feel like stopping, and then you see someone at your back saying, keep going, keep going, keep going, you can do this. Like, this is the kind of vibe that I get from like INR. They just see that you can be better. And I'm thankful to Fellowship of Christian Nurses Southwest Zone, because if they did not bet INR, I wouldn't have that platform, I wouldn't have that support. Although I have been part of the Fellowship of Christian Nurses since my undergrad, but my relationship with it got more better with INR, being involved in INR. Yeah.
Thank you so much for your response to that. Moving on, there's something particularly interesting about, you know, one of the posts you share on Twitter about, you know, your thesis, your PhD thesis, is the topic. A lot of people specifically wrote that they love the title of the topic. And I was just thinking and reading it, I'm like, this is, you know, there are some topics in research that are just on the surface, you know, maternal, you know, we have accident and emergency. But yours was specifically, in fact, you mentioned music intervention, you know, the effect of multi-concept music. I'm just curious, why that particular topic, really?
Actually, from my master's, I've been working on pain management, and as a nurse, you know, the limitation we have with our involvement with pharmacological therapy. And so I've been working on non-pharmacological therapies that nurses can actually use to alleviate pain for patients alongside the pharmacological interventions. During my master's, I tested a similar intervention on patients who had undergone thoracic surgery. And during my PhD, it's mastectomy patients. So actually, music intervention came about from my findings from systematic review, and also the culture of Africans. Music is actually deeply engraved in the African culture, and you really cannot tear apart an African and music. You really can't tear them apart. Like anywhere we get to, there's that vibe of whether you are doing burial, you're doing naming ceremony, it is wedding, it is graduation, whether anything, yeah. Even just when you're not even doing anything in your house, you just be hearing all this deck sound, giving you those bass vibes and all those stuff. So actually, based on my findings from my review, because the study was in 3 phases, and then the first phase was a review, which pinpointed that we can use music to manage anxiety and also manage pain. And then looking into the population of those who are breast cancer patients who are undergoing mastectomy, And considering the situation in Nigeria, that non-pharmacological intervention is not something that is commonly used in the clinical setting. And then we actually explored we did a qualitative interview of some patients, and then we found out that they don't even know that they can, even though they listen to music every day, they don't even know that you can use it when you're feeling pain. You can listen to it as a means to distract you from your pain and reduce the amount of medication that you consume. So we went ahead to use the findings from our review and interview with the patients to bring up that kind of intervention. So because the intervention was not only music listening, it had other parts like patient education, telephone calls, and face-to-face follow-ups and things like that. We could not just put music listening. It has many components. So that's why you have the word multi-component music intervention there in the title. Yeah.
Thank you so much for that response. I have conversations around research with my colleagues. We found out that many of us do not enjoy research. We see research as, like a secondary thing. And while nursing subjects like, mental health, physiotherapy, or anatomy and all those things as a core aspect of nursing, the foundation of nursing as a core aspect of nursing. To you, why do you think this is so among healthcare practitioners that do not particularly, have that interest in research? And what are the ways we can, push that interest?
So I would say that it boils down to two things. People already have this belief that research is difficult. So, and you are what you believe. So it's what you believe that you actually manifest. If you already think that you can't understand this thing, then there's no amount of effort that you put in. What keeps coming to your mind is, I cannot understand. And I would say that another thing is probably the way research is being taught is another way. The way research will be taught to someone who has never heard of research before is different from the way research will be taught to someone who is at the novice, at the intermediate level, or at the expert level. So I think maybe because most of the professors in Nigeria, they are at the expert level, so it's a little bit difficult for them to bring the novice to that level, or probably because the novice student sees the professor as expert, so they kind of like see them when they are speaking as, there's a gap. So they kind of like see them as, oh, they are speaking fire, or this person is so jim, like they know it all and they can't understand. Research is abstract. Let's not lie about it. But I don't believe in the fact that it's not doable. There is no one who cannot understand, even if it's the simplest case report in the hospital. And basically every day nurses do research. Every day nurses do research, because the moment you start putting down the data of the vital signs, like you are interpreting which patients need tepid sponging, you're already doing your research. You are making actions, you're doing something. But the problem now is how to fix all the data that you have together, to write it into something and to describe the method and everything is what challenges nurses most. So I think one of the things I would say is that you need to take off the idea that it is difficult. That is it's the fundamental thing that every student or every nurse should try to like take out of their mind, that research is difficult. I am not saying it is easy. Neither am I saying it is difficult. It is just like you studied for your anatomy. You did not know about all the functions of the muscles that you now know from learning anatomy. You did not know them before. So the same way, you don't know so many things about research. You are here to learn it. So don't put your mind that it is difficult. And for the professors, I think that maybe they can try to like come down a little bit to our level and try their best to relate practical, maybe provide practical steps, like I don't know, for each phase that they teach, like identifying a topic, research topic. They can ask the students to identify a topic and put them through and correct them, maybe just step by step, not for the exam purpose where they need to know how to do chapter 1 to 5 and things like that. Yeah.
You co-authored a book titled The Period Passport with a colleague of yours. Can you tell us about that book briefly?
Oh, you really did a lot of research about me. I'm not so
Yeah.
vocal about so many things. Okay, so I co-authored a book titled The Period Passport. And this book is actually about the experiences of young girls with respect to access to menstrual sanitary wares, and then how children of our dads could get involved in the menstrual life or menstrual growth of their daughter, and then also for children whose father is or are incarcerated, or for men who are maybe I don't know, menstruating people. Yeah, let's use that word, because we are in an advanced world now where you have the transgender and things like that. So we would say menstruating people. So it's important that they understand about the poverty related to period. They understand that there are some people who cannot afford sanitary wear. There are some people who can afford it but don't have access to information about sanitary wear. The right one, the right information is actually difficult to come by, in terms of someone asking you, if I use a tampon as a virgin lady, will I get disvirgined? And am I allowed to use a menstrual cup? How often should I change my sanitary pad and my menstrual cycle and things like that? So this is actually basically an informative book, which I would advise as many people to there are some to buy it, and there are some people who think, oh, I know everything about my period. Go and get it and come back and tell me what you already know and what you gain about or what's the new knowledge that you found out in the book. So yeah, this is basically what the book is all about, providing information, how dads can get involved in periods and things like that. Yeah.
Yeah, thank you. I'm going to drop the link to get the book in the description section of this video. Let's just tone the conversation down a bit. We're already approaching the end anyway. I want you to select one of these options for me, if you don't mind. Are we ready? This is another segment of this question. Okay, are you ready?
Okay.
Yeah.
Am I going to get something for selecting?
We discussed
So
that.
it sounded like, okay, you're going to select one and you get whatever you select. So I should get prepared. Okay.
Yeah, so the first option is Android or iPhone.
Android or iPhone. I think I'll go with an iPhone.
iPhone.
Yeah.
Bedside or office? I know. I feel like I know the answer already.
So let's just not answer that one. Let's just skip that one.
Shift or night shift? Yeah.
Let's just skip that one too. It's related to the previous question.
Okay. APC or PDP?
None of the above.
You seem to be aware of the current situation in our political system.
None of the above.
Yoruba movie or Indian movie?
Is there an option for both?
No, you have to pick one. Indian movie.
Not really. I think I'll go with Yoruba movie.
Yoruba movie, okay. Thank you so much. So Dr. Yetunde, what next? What should we expect from you?
So what next? I think if I have a penny for, or if I have $1 for every time I've answered this question since last Thursday, I should be a millionaire now. Like, what next? I think that the next step is just to use the knowledge that I have gotten to better the lives of others. That's in what way that would manifest, I don't know yet, but that's the next line of action for me.
Yeah, amazing. So what are your final words for anybody that's this, particularly young persons?
Just keep working on your dreams. They are valid, and then you're whatever you think you are, and you will be whatever you think you will be. So think positive. Yeah, those are my final words.
Think positive. Thank you so much, Dr. Yetunde. I really, really appreciate your time and commitment to have this session with us.